In hematology, accurate platelet measurement is critical for diagnosing bleeding disorders and monitoring patient health. The direct platelet count using a hemocytometer allows us to manually determine the concentration of these essential clotting cells. A healthy patient will typically have a count falling strictly between 150 and 450 times 10 to the 9 platelets per liter of blood. We will use this baseline to interpret our final results. Before preparing a sample, establish a safe working environment. Put on your lab gown, wash your hands thoroughly, and don a mask, gloves, and a protective head cap.
Working directly with whole blood requires absolute precision. Even minor pipetting errors in this manual procedure can drastically alter the final calculation, potentially leading to an incorrect diagnosis. We begin by attaching a mechanical suction device to an RBC pipette. Carefully insert the tip into a well-mixed tube of whole blood and slowly pull the plunger until the sample reaches exactly 1.0 mark. Next, wipe the exterior of the pipette using a clean cotton gauze. Move carefully from the bulb toward the tip, but you must avoid touching the open end itself. The 101 microliter volume inside is critical, and touching the tip will wick away blood and ruin your measurement.
To dilute blood and destroy red blood cells, we use a specific fluid, 1% ammonium oxalate. Draw this diluent steadily into the pipette until the mixture reaches exactly the 101 mark. This combines 1 part whole blood with 99 parts diluent, giving us the required 1 to 100 dilution ratio. Cover the tip with your middle finger. Safely remove the suction device and seal the top opening. Now, vigorously rotate the pipette back and forth, moving only your wrist for 45 seconds. This intense mixing, combined with a strict 1 to 100 ratio, physically separates the cells. This creates a countable density when we place them under the microscope.
While the mixture sits, construct a humidity chamber. Take a petri dish and place a moist cotton gauze inside. Then lay 2 broken applicator sticks across the gauze about 2 inches apart. Before loading the sample, remove your thumb and slowly release your index finger to discard the first 3 to 4 drops of the mixture onto a waste gauze. This clears any unmixed diluent from the pipette stem. Now place the pipette tip into one of the hemocytometer's V-slashes at a 30-degree angle.
Slowly release your finger to let the fluid flow evenly and completely under the cover slip, being very careful not to overfill the ruled area. Carefully place the charged hemocytometer onto the sticks inside your humidity chamber. Cover it and let it stand undisturbed for exactly 10 minutes. Giving the platelets this time to physically settle ensures they drop out of suspension and rest evenly on the glass grid. This places every cell on a single readable focal plane and prevents optical distortions.
Move the hemocytometer to the microscopic stage and lower the condenser to increase visual contrast. Focus initially under low power objective, then shift to high power objective. This displays the hemocytometer grid. Focus on large center square mark. Inside are 25 smaller squares for counting platelets.
Start in the uppermost left square. Move across the top row. Drop down and continue the snake-like pattern until every square is covered. As you examine every small square, apply a strict boundary rule. Any cell that touches the top line or the left line of the square must be counted. Conversely, if a cell touches the bottom line or the right line, you must ignore it. Sticking to these rules ensures that the cells resting on the border is assigned to a specific square, preventing double counting errors across the grid. Convert the raw count using the standard formula. Cell counted times dilution factor divided by area times depth. The fixed values are 100 for dilution, 1 for area, and 0.1 for depth. Plugging in 200 platelets gives a final calculation of 200,000. We report this final value as 200 times 10 to the 9 power per liter. Comparing this against our initial baseline, we can see that this MAC patient falls comfortably within the normal range.
Translating that microscopic read count into a reliable metric gives a physician the specific data they need to assess patient's health. With the procedure finished, simply dispose all used materials into the appropriate biohazard waste containers.